Everyone, and welcome back to Case Study Part 2. My name is Amber Gonzalez, and this is for SPCE 638, Section 803, and today we will be discussing Client X's behaviors further. Today, I will be reviewing Case Study Part 1, discuss Client X's behaviors, the interventions, and their descriptions along with the functional relevance and whether they are evidence-based practices and how that ties in with the BCBA task list items. Client X is a 5-year-old male who was diagnosed with autism spectrum disorder at 3 years old. He has been receiving ABA services for 20 months. He engages in noncompliance, aggression, and self-injurious behaviors. Results from the questions about behavior functions were noncompliance, tangible with a possible secondary function of escape, aggression, tangible with a possible secondary function of attention, self-injurious behaviors, tangible with a secondary possible function of escape. Client X's behavioral targets for decrease again include noncompliance, which is defined as any combination of verbal protest, throwing himself to the floor, whining, crying, kicking, eloping, aggression, or SIB. Examples include if a demand is placed and the client X drops to the floor and verbally protests by saying no. A non-example is a demand is placed, the client verbally protests, but he is also complying with the demand. Aggression is any instance where he bangs himself into you, hitting someone with an open or closed fist, shoving, pinching, attempts of biting, or kicking. An example of that is the client runs at you and he uses his head to hit your stomach. A non-example is the client is playing duck, duck, goose and taps a peer on the head with an open fist. Self-injurious behaviors which is any instance of banging his head on the floor, wall, windows, or hitting himself on his head with an open or closed fist. An example of that is the client drops to the floor with an open hand and hits himself in the forehead. And a non-example is the client listening to head, shoulders, knees, and toes, and then uses an open hand to touch his head. So for our noncompliance is what we're going to be talking about today. The triggers and antecedents, leaving a room or activity after engaging in physical aggression, denied access to items, activities, or objects, moving his table session visual away from green, items aren't working how he wants them to be working, trouble completing tasks. Examples of that include climbing the rock wall, opening a bag, putting together toys, and then the function of the behavior is escape and tangible. Today, we're going to focus on noncompliance. Noncompliance includes instances of SIB and aggression as well, and that is why we're going to focus on that behavioral target. Behavioral or proactive strategies include assessing motivation consistently throughout the session. We're going to prime the client, letting him know, hey, we have 5 more minutes in gym, we have 3 more minutes, and then 1 more minute. We're going to use visual cues. We're going to provide the client with choices as often as possible. And then we're going to go over the rules or the contingencies at the onset of the interval for the DRO procedure. So for example, we need to have safe hands, safe body, listening ears, and kind words. So our reactive strategies include that when noncompliance occurs, we're going to lessen verbal engagement and begin to use gestures. We're going to flip over a green visual to the red side, and we're going to pause our DRO timer and remind him of what he is earning, or we are going to reassess motivation. If he complies within 15 seconds, we're going to turn the visual back to green and unpause the timer. This is going to be the only time that we unpause it. Anything after 15 seconds, we will restart that DRO timer. If he initiates interaction by asking for a hug or attempting to be picked up, then we're going to use the motivation to complete the task demand that was originally placed. Keep the language simple, first, then language. If he re-escalates, we're going to pause the timer and flip the visual to red. Keep calm, no verbal until he initiates. We're going to have a flat effect. If elopement occurs, we're going to make sure he's in our eyesight at all times, catch up to him and prompt him to walk back to where he's supposed to be. If functional language is appropriate to leave, then we're going to provide him with that language to leave. Otherwise, we're going to follow through with the demand that was placed. We're going to begin our noncompliance timer after 2 minutes of engagement, and we're going to stop the timer after 1 minute of compliance. So again, we're taking frequency data and duration. Once the client is compliant and completes the task, we're going to restart that DRO timer and go back over the rules. And we're going to tell them why we are restarting the timer. We did not have safe hands or listening ears. Let's try again. And we need to make sure that we are reassessing motivation to make it through that DRO, through that interval. So for our DRO, procedures consist of delivering reinforcement contingent on the problem behavior not occurring throughout intervals of time. The DRO procedure can be tailored to any function as it is contingent upon the target behavior not occurring. We need to plan for unwanted effects, which can include the possible reinforcement of other problematic behaviors not specified in the contingency. In an article by Labrat and colleagues, they effectively used a DRO procedure to increase appropriate behavior in preschool age students. You can't really have a DRO without a DRA. So for the alternative behavior, we will be teaching the client functional communication. So we'll be teaching them to request more time with preferred items and activities, as well as requesting the removal of a peer, staff, or activity. Contingent upon the alternative behavior being admitted, the client will gain access to the tangibles or escape the aversive situations. And then we're also going to add extinction, and we're no longer reinforcing previously reinforced behaviors. So we will no longer be providing escape or access to tangibles contingent on the problem behavior of noncompliance occurring. And then unwanted effects we need to plan for as well for extinction include an extinction burst, initial increase in response magnitude, spontaneous recovery, resurgence, and or emotional outbursts and aggression. All three of the interventions are evidence-based and can be tailored to the function of that targeted maladaptive behavior. So again, with our DRO, it can be tailored to the function. So extinction, right? We're no longer reinforcing for that maintaining consequence. And then our alternative behavior, functional communication. So some things that we touched based on that integrate with the BCBA task list. We're establishing our operational definitions of our behavior, noncompliance, aggression, and SIB. We use positive and negative reinforcement procedures to strengthen the behavior. So teaching the functional communication for escaping for our negative reinforcement. Use instructions and rules for our DRO procedure. Use reinforcement procedures to weaken behavior, DRO. We're going to use extinction, state intervention goals in observable and measurable terms. We identified potential interventions based on assessment results from our QABF. Recommended intervention goals and strategies based on such factors: client preferences, supporting environments, risk constraints, and social validity. When a target behavior is to be decreased, select an appropriate alternative behavior to be established for increase, our functional communication. Plan for possible unwanted effects when using reinforcement, extinction, and punishment procedures. Here are some of our references. I hope you guys enjoyed today's presentation, and I hope you join us for case study part 3, where we will discuss how to train staff on the interventions discussed today and ways in which we will discuss treatment integrity and validity. Thank you.